Hi, Dr. Fauci. Thanks so much for joining.
Hi, how are you?
I'm good. I'm Jessica. I'm the health and wellness editor at Motherly. It's such an honor to speak with you today.
My pleasure. It's good to be with you.
Thank you. So let's dive right in. I just wanted to ask what many parents of young children really want to know, which is when will vaccines be available for kids under 12?
Well, very likely this fall, probably mid-fall. The studies that will lead up to the authorization to do that, to determine the safety and the immunogenicity of doses in children 11 to 5 years old, are already ongoing. For the Pfizer product, we'll likely get data by the end of September, the beginning of October, at which point the company will submit the data to the FDA to get regulatory approval. That usually take an additional couple of weeks for them to carefully go over the data. So that would mean sometime in October, mid to late October, we'll get the Pfizer approval. And then Moderna is usually about 2 or 3 weeks behind, so that probably should take place sometime in early November. The bottom line is 40,000 foot look at it is sometime in the fall, mid to late fall.
Mid to late fall. That's great. That's hopefully, as what parents are expecting and have been seeing around town. What do you think that means for kids under 5?
Well, kids under 5, we're also going down to that level. We do an age de-escalation study, but we also give a lower dose in children because of the obvious difference in size between a 3-year-old and a 9-year-old. So those studies will also be ongoing. We will likely get the results of those a little bit later than what we said for the 11 to 5-year-olds. So probably sometime before the end of the year. I think it would be safe to say that, but sometime after the 11 to 5s.
That's great. Thank you. What guidance would you offer for parents who may be reluctant to vaccinate their young children, or for pregnant women who are reluctant to vaccinate?
Well, let's start with pregnant women, because that's very, very clear that COVID-19, the infection and the disease, can really wreak havoc with the pregnancy, both for the pregnant woman and for the fetus. And we have ample data now with experience of women who get infected during pregnancy that it can really lead to some severe outcomes on the part of the woman's health herself, as well as for the safety of the pregnancy itself. So that's the reason why it's very clear now that it is recommended by virtually every society that has anything to do with OBGYN that pregnant women do get vaccinated. Talking about the safety and the reason for vaccinating children, even though statistically children who get infected have a less likelihood of a severe outcome compared to adults, and particularly elderly adults, that doesn't mean that children cannot get significantly and seriously ill from getting infected. And all you need to do now, particularly at the height of the Delta variant spreading, where we have, an average of about 130, 140,000 new infections per day, that if you look at the pediatric hospitals, there are a lot of children in the hospitals who are seriously ill enough to have required hospitalization. So I think we need to get rid of that false impression that it's okay for kids to get infected. It isn't. The likelihood of children getting into trouble, to be perfectly honest, is less than an adult. But that's a false comparison, because already more children have died from COVID-19 than kids do every year from influenza. And we vaccinate children against influenza.
Right. Yeah, it's pretty stark, the differences there. And with Delta on the rise and pediatric hospitalizations on the rise, I know many parents are now weighing the risks of sending their kids back to school in person versus keeping them at home or doing a virtual experience. What counsel would you offer them if they're trying to weigh those decisions? Would you send kids back to school if they're preschoolers?
We have enough information over the last, year and a half of the significant deleterious effects of keeping kids out of school physically. That's everything from mental health problems to social developmental and educational developmental problems. So we want to do as best as we can to get the kids physically back in the classroom. But in order to do that, you want to make sure you do it safely so that you don't compromise the safety or the health of the children. And there are a couple of ways to do that. One is you surround the children in the school setting with people who are vaccinated. That means making sure the teachers are vaccinated, making sure the personnel who interact in the school system are vaccinated, school bus drivers, people in the cafeteria, all the people who come into contact with the children. And then superimposed upon that, you want to make sure that everybody wears a mask, particularly now that we have such a high level of viral dynamics in the community. People often ask, well, if we're vaccinated, why do we need to wear masks? Well, when you're in, which will mostly be in most parts of the country, an indoor setting, you should try to get as good ventilation in the school as you possibly can. There's a whole list of layered prevention modalities that the CDC lists on their website about how to get kids back to school safely. And I think it would be a good idea if people want to do that, to go to that website and to take a look at some of those recommendations.
Yeah, that's great. I'm sure that would be super helpful. And what about for kids under 2 who aren't eligible to wear masks? Same kind of recommendations, ventilation?
Shield them. You've got to really provide a protective cocoon around them. Mm-hmm. Keep them away from people that are not vaccinated. Mm-hmm. And when you're in an indoor setting, make sure people wear masks so they don't get infected, then go home and inadvertently and innocently infect their children, because they may be vaccinated. They may have no symptoms if they get a breakthrough infection, and then come back home and literally accidentally infect their own kids. You don't want to have mothers and fathers and parents wearing masks in their own home, but you want to make sure when they are in indoor settings outside, even if they are vaccinated, that they don't get one of those asymptomatic breakthrough infections, which would endanger their own family.
Yeah, that makes sense. What about, we know that some parents are understandably very eager to get their kids shots as soon as possible. And we just reported about how some are actually fudging their kids' birth dates in order to get, like, 11-year-olds, say, the shot for 12-year-olds. What counsel would you give to parents who are considering the same?
I think that they should stick by what the official recommendations are, because there's a reason for that. You don't want to go down to a lower level unless you've proven that it's safe and that it induces an appropriate immune response. You could understand the anxiety of parents who want to get their children vaccinated. Once they make that decision, they want to do it as soon as possible. And that's the reason why in the clinical trials, we're working as quickly as we possibly can. And the FDA is examining the data in as expeditious a manner as they possibly can.
Yeah. We've got about 1 minute left. I just wanted to ask about President Biden's new vaccine mandates. Do you think that those will help get us back on the right track?
Oh, I do. We try and extend ourselves as best we can. We get trusted messengers, we get incentives, we do a lot of things to get people vaccinated. But you reach a point when there's a core group of people who are not going to get vaccinated unless they are put in a position, if they don't get vaccinated, something is going to happen negative. And that is, they may not be able to go to work, or they may require getting tested frequently. So if you have that kind of a push to people to get vaccinated, I think it will make a difference and a lot more people will get vaccinated.
That's wonderful. Yeah, I really hope so. And finally, for breastfeeding parents, do you recommend vaccination for them?
Absolutely. It's not only good to protect them, but you also get antibodies through the best breast milk to your child. So you will be able to protect an infant who clearly is too young to get vaccinated during the time you breastfeed, because the baby will have protective antibodies.
Yeah, it sounds like it would be especially helpful for those under 6 months who still won't be eligible for vaccination.
Absolutely.
Yeah,
Absolutely. Right.
wonderful. I think that's all the time we have for today. Thank you so much, Dr. Fauci.
My pleasure. Thank you for having me. Good to be with you.
You too. Take care.
All right. Bye-bye.